My name is Dr. Sylvester Youlo. I'm an orthopedic surgeon, so I work in the orthopedic surgery department here at Phelps Health. I grew up in a very small town, in fact in a very small country in West Africa called Liberia. And where I'm from, fortunately, there was not a lot of doctors around. In fact, it was very, very hard to see a doctor. And growing up, I experienced a lot of illness. I saw a lot of people that were pretty sick, and most of them died from illnesses that could have been treated with a doctor's help. But we didn't have much doctors, and so very early on when I was a young man, I decided, you know, one day when I grow up, I'll become a doctor and come back in this small town where I grew up to help the people there. So it is an interesting story. When I decided I wanted to be a doctor, at some point I got interested in being a surgeon. And at the end of my first year of medical school, I decided to go back home to the country I was raised in to work with a doctor there, just to experience how medicine was practiced back home. And when I went there, what I quickly realized, and even though this was a bigger city of a small country, what I quickly realized was that there was not orthopedic surgery being practiced there. There was not an orthopedic surgeon. In fact, in the entire city, there was one doctor who did anything related to orthopedics. And during that visit, I saw a lot of orthopedic related injuries that we tried to manage while I was there. And from that experience, I decided, you know what, instead of just being any surgeon, I'll be an orthopedic surgeon one day when I'm done with medicine. So after medical school, so when you go to medical school, you finish medical school, you have to do your training in whatever specialty you want to do. And I went into orthopedic surgery. The training is 5 years. I went to one of the best universities in the country, at University of Wisconsin in Madison. And after my training in orthopedic surgery, you can go ahead and start to practice orthopedics because you've had your training and become a surgeon. But once I was done, I had a special interest in taking care of patients that have sports-related injuries as well. So I did a fellowship training in sports medicine. I went to the University of Kentucky, spent a whole year there just treating patients that had sports-related injury, taking care of Kentucky basketball, Kentucky football for a year. And after that, I had these both dual training experiences in general orthopedic surgery and special training in treating patients that have sports-related injuries. So my training gave me a special capability to do two things. I can take care of the young patient who plays sports, and the older patient who also is a weekend warrior that go out there, play sports, tore their Achilles tendon or tore their rotator cuff, have a cartilage injury in their knee. I can take care of those people. My training also allowed me to be able to take care of patients that are older, patients that develop arthritis after years of playing sports, after years of doing things, but now have arthritis that can't do things they like to do. I can take care of those patients. One of the unique things about Phelps Health, in fact, that drew me to this organization, is the placement where Phelps Health is located. Phelps Health reminds me of the kind of place I grew up in. This is a small community, it's a rural community, and to have a hospital that is willing to take care of the needs of these people in this rural community is phenomenal. And so when I interviewed here, when I came for this job, when I saw the community, when I drove around, I got to meet a few people. It felt like home. It kind of felt like home. And so the organization have great doctors. Our department in orthopedic surgery have wonderful doctors. With patients that have been here have had a lot of wonderful experiences. And so I'm excited to be part of this team. And again, it kind of feel like home because it's a small community and I get to be part of this community. I'm a surgeon, that's what I do for work, but I do have a family. I have a wife and 3 kids, a boy and 2 girls. My kids play sports, and so on the weekends we go out to play sports with them, drive them around to enjoy sports. When we are not playing sports, we are doing homework. When I'm not working on the weekend, I enjoy cooking, so I do most of the cooking for my family. So as a patient, when you come to see me, there is one thing I want you to understand. One is, seeing me is about you. It's not about the doctor, it's about the patient. And the first thing I do when you see me is I get to meet you, I get to understand and let you do the talking. Tell me about why you're seeing me, what's hurting you, what is preventing you from doing things that you like to do. Once we figure out exactly what is hurting you, my job is to help figure out the diagnosis. What is the problem and how can it be treated? And once we find out, so what we usually do in my clinic and what you experience is, it is a shared decision making. I gave you guidance, I gave you information about your problem and how to solve it. I give you information about what can go wrong and what can go right. And once we figure out exactly what we can do for you, I let you make that decision with the help of our medical knowledge. And I'm hoping to get you back to the best of your abilities and at least make your pain to go away.